I believe that we have folks backstage now that I will introduce for the next portion of our day, which is the funding strategies, as you heard. I am going to introduce Matt Abatement. And Matt,
hey,
it was bound to happen that there was going to be some snafu. I had your bio right in my agenda here, but you don't need a bio.
Yeah, just Matt from HUD.
You just can go and flow with it. It's so great to see you again. So nice to have you with us today. Matt, share with us, as all of you may know and recognize, Matt is director of the Office of Lead Hazard Control and Healthy Homes at HUD. And Matt, feel free to give us a little bit of an introduction yourself, because my screen went blank and we're just going to go with it.
No, not at all. I'm just Matt from HUD, just a federal worker in his laundry room doing work like everybody else does, during COVID and everything else. Thank you all for inviting me. I think this was the 5th platform I've done today, like different platforms and trying to log on and everything else. But welcome to National Poisoning Prevention Week. This has been a phenomenal week. Really a lot of news today. If anybody watched the president talk today, as well as if anybody kind of peeked at some of the bill language in the House for the Build Back Better bill initiative, and I think Amanda's probably going to talk about that. I will say that what we have seen and what we have worked on in terms of writing is transformational in terms of funding opportunities. So just a quick primer, 2 pieces of information: the bipartisan infrastructure bill, and then the Build Back Better reconciliation bill. Both of those have lead components in it, and runs the spectrum of a lot of stuff. So in this case, both of those pots together really very much serve the needs of you all working locally. And as you all know, every time I talk, it's about how we can better support local efforts and what we can do to eliminate barriers. And I think the way that we have written this Build Back Better piece was going to make everybody very, very happy. In terms of flexibilities, in terms of not having the guardrails that we normally would have in our traditional program. So it's a very exciting day. And I just got off another meeting with the Secretary of HHS, with EPA Administrator Regan, Secretary Becerra. So it was a great day. So we had our President's Task Force meeting on environmental health risks and safety risks to children. And we talked about a lot of stuff that the agencies are doing together, not only with the EPA draft strategy to reduce lead exposures, also with the lowering of the blood lead reference value, CDC, which I'm the chair of the LEPAC committee, Lead Exposure Prevention Advisory Committee. We're talking about our grant announcements that are forthcoming in the next couple of weeks, a lot of money for healthy homes production, and also a lead portion, our second lead go-around. We talked a lot about climate change and emergencies and disasters and the work that we're doing together in terms of creating a new subcategory within the President's Task Force and energizing all the agencies around that. Asthma is still huge that we keep talking about. So, for us, I don't know if I have slides. I know they're somewhere. Oh, there they are. I wasn't even going to use them. If you don't need them, that's fine. But for us and our work collectively, our work all together, a housing agency talking about health, how novel, right? But for us, our work is around driving communities, improving communities, right? And that focuses on mitigating the impacts of unhealthy housing. And that focuses on improving communities and preserving affordable housing. And most people don't think about our programs as preserving affordable housing, but there's no way we can build enough affordable housing to meet the needs of any of us in the next 10, 20 years. So we need to make better the stock that we have. So this improves existing stock. And in that vein, it really does preserve affordable housing. And for us, there's been a lot of talk about equity and environmental justice, which really sits at the core of what we do. In that, when you talk about equity and environmental justice, You can't really even discuss that if you have conditions in the home that are making it so the young children won't reach their full potential before they even reach kindergarten, right? And so our programs really focus on ensuring that future generations can reach their full potential. And, regardless, and in the agencies, there are 17 of them there today. And I've always said that regardless of in what agency you are, or whether you're federal, state, and local, or what discipline you're in, we all share a set of common outcomes, right? We're trying to not only improve communities, but we're improving the quality of health and life for the families, the residents, and the children that live there. And all of us work in that mind frame, no matter what the nouveau term is, whether it's equity, environmental justice, or social determinants of health, doesn't matter. We're all doing the same thing, which is, focusing in terms of improving communities and quality of life for folks. Next slide. So a tiny history about our office. We were created a long time ago. And it's in the Office of the Secretary, which is nice because that means that we have pretty broad influence over all the programs at HUD, and that our office has to be run by a career person. That's me, which is helpful as well for continuity. But it just makes it easier. It makes it easier being in the Office of the Secretary and being able to reach out among all the different facets of HUD stock, whether it's assisted stock or unassisted stock, it doesn't matter. And one thing that we have learned in all of that is, again, I've said this time and time again about working with locals and being the ear for locals and raising up issues and changing what we do on a regular basis. And probably the biggest thing that's happened over the last 15 years is getting the authorization from Congress to allocate healthy homes funding, which is not underlay by a statute or a law or a regulation. It doesn't have the guardrails of lead. And in that way, it is very much flexible towards the use of communities to improve houses by taking a holistic approach, right? I think that's the whole purpose. And we've been effective at convincing our funders, that it's worthwhile to continue to do this so that we don't have programs tripping over each other. We can get it all done in one slug and get it all done. So for us, our focus is on obviously improving housing stock. We've been doing this for a long time, and we have learned a lot. And what we have learned is that nobody can do this alone, right? We've learned the value of not only listening, but the value of partnerships and the value of collaboration and the value of showcasing our work locally so that we can bring additional capital into communities that have been disinvestment for many years. And we have been effective at doing that around the country. On the last slide, I'll talk about that, but it really is about showcasing the work and, using our dollars in a transformative way, one house at a time, right? It just starts with that one house, and people say, "Hey, that's pretty cool. That's a great looking house." Oh, and everybody inside that house has improved health outcomes. Hey, how can we get involved with that? So it's nice, and it's also nice that. In a lot of ways, I feel like our office is kind of the glue between other agencies and other work going on, where we can be very helpful by being on the different committees and task force and things of that nature that we've been doing for years, and being really advocates for this work on behalf of you all every step of the way. Next slide. So many of you probably know our programs already. I mean, we have grant programs, and we do research. We do enforcement, which is a joint enforcement with the US EPA for the lead-based bank disclosure rule. We have our lead-safe housing rule. We have our guidance and performance criteria, the HUD guidelines. Everybody knows the HUD guidelines. And outreach. Everybody kind of has those components. And next slide. The one thing that you'll see is that everything kind of builds into focusing on outcomes, right? So we know this work matters. We know the value of every dollar and what we get back out of it. That's sort of what this slide talks about. We know the cost benefits. It's strange that it has taken 15 years to convince people about the term healthy homes and healthy housing, and how lead is a part of that, and how really focusing on the prevention rather than the patient side is going to make all the difference in the world. Next slide. And our funding has grown, and we're lucky. So we were probably the last time we all got together face to face, we were probably at 120 million, something like that. Our annual regular appropriations is around $400 million now. And so that's increased dramatically. And we've done our best to get the money out to you all. I will say that this is one of those really strange years, and probably because of COVID, that less people asked for the money than we had. That rarely ever happens. We can't have that happen again. We know this problem exists. We know it's not going away. We need to have jurisdictions, state, local, continue to ask for this funding to be able to do the work that is needed. And we've done everything internally to make it easier to access this capital and reducing the application process and everything else and streamlining as much as we possibly can. Because the issue shouldn't be you can't get the funds. The issue should be we should be working together to implement the funding to what is best for your communities. So I encourage, if you have not or did not apply, continue and please encourage others to apply. Because again, the last time people applied, it was a lot less than what we had now. So the $400 million is the regular appropriations. I'm not going to get into what Amanda will probably talk about with the Build Back Better, which is substantially more money available. This is, again, record historic money that will be coming down. Of course, if everybody votes right? I mean, it all comes down to that, but it sounded like they were pretty close to having that done today. Next slide. So, for us, it's nice that in terms of the top part, being able to communicate effectively and working together for the right action plans and having a strategy in place so that everybody knows where we're going, having the right plans in place, again, to be able to support the local work. There are a lot of things that we've achieved. The huge hurdles that we've accomplished were, related to smoke-free housing and radon and integrated pest management. And even on the President's Task Force today, the Health and Human Services mentioned that we had started the asthma summits way back when with HHS. And that has really carried on in terms of being successful in getting states to adopt the work as part of a sustainable funding for work in home-based asthma assessments. And Amanda's been a huge part in looking at the data for that and been really great, her organization, in moving that forward as well. But we're really happy about the public-private partnerships as well. So this is not just about our funding. This is about showcasing the value of what we're doing and bringing more capital in, because the more we can do that, the less reliance on our funding, and it's more of a sustainable pot of funding that should be used and can be used locally. We're very proud to be supportive of the local ordinances. You guys mentioned Rochester before. We're really pleased about their pre-rental occupancy inspection ordinance. We did a lot of work with Cleveland and getting theirs done. There's Akron, Buffalo. There's a lot of really good local innovation that needs to be brought to scale around the country. And I did see in the chat, actually, from Houston, I did a speech this morning for Houston about block captains. Novel, innovative, that works. That works locally. I mean, that's basically door to door. It's a great approach. So the more we can learn about and elevate those local innovations, the better off we're going to be, right? Because we need to be keeping on top of the different changes and the different nuances, which really make a difference. And lastly, of course, we've been part of chairing some pretty large committees, both in terms of Healthy 2020, but the Federal Advisory Committee, and I'm the chair of the LEPAC for the blood lead reference value. So the bottom line soapbox thing for me is that there's a lot of money available. There's a lot of money available, and we need to work together in making sure that folks access the funding and the funding gets to where it is needed most, which is not the Treasury, which is not HUD. It is in your communities. So I will pause. I think I flew through mine pretty quickly. I guess we'll I'll hand it back over if we have additional questions. The last thing, the slide. Last slide. So this is what really makes me happy. We used to do this once a month around the country. We would go and we would do different events. The top middle is the one we did in Harris County, Houston, in Baytown, a little town called Baytown, where we had done one home with Lowe's. We had done immunizations for the school. We had worked with the local health clinic. We built a Kaboom playground, which is on the bottom left there. Did a lot of work to showcase our work. And it was amazing the reception we got, and people saying, gosh, we never had anybody come out here and look at our little community. And every community matters, right? Every community matters, and every dollar we can put into communities matters. And that's what we want to showcase on a regular basis. The upper right is we always tend to do sessions at schools. And so we did a session where kids can learn about healthy homes in school. The one fun fact is that we use those events so they can draw for us that we use in our Healthy Homes calendar. We'll say we probably need 5,000 kids to get a couple of months worth of good photos or good drawings. It's pretty funny. In the last bottom middle there, I did the work with Rebuilding Together, who we've worked with forever. I was putting a patio in the back for a homeowner who was elderly, and the back patio was like a wave. And so I'm always proud to, and I was working there as Matt, not as HUD. I'm always proud to be able to do work in communities because, again, at the end of the day, me sitting in my office at HUD doesn't equal what I can do in the communities to showcase how much this work matters. Thank you very much.
Matt, we're ready to build in Pittsburgh.
I've been asking, come on.
We are ready. So after today, we'll just look at calendars, get something scheduled. We'll be ready to go.
Glad to come out, yeah.
Matt, we are so fortunate to have leadership with you at HUD. And thank you so much for being with us today. To have a champion in that integral department is so crucial. And you have had that steadfast voice, and that is what's needed. And we greatly appreciate that. So I had mentioned that I didn't have, my screen had disappeared, but I'm going to go back because I want to tell people more about you. And then we'll move to Amanda because I know that we're short on time. But for folks who don't know, Matt has been instrumental in leading the department to addressing housing conditions that threaten health. And he authored the HUD's Healthy Homes Strategic Plan and led a federal interagency work group to develop the Advancing Healthy Housing Strategy. So these all align with the goals and priorities from numerous federal agencies to create healthier housing. And we would be remiss if we didn't share that with others. You had the opportunity to share in your presentation, Matt, the other contributions that you have done that have been seen at the federal level, Radon Action Plan, the Action Plan to Reduce Racial and Ethnic Asthma Disparities. These are all critical components that all come together to addressing healthy housing and making communities healthier, safer spaces. So with that, I'm so very appreciative. You had mentioned the National Prevention Council's national strategy. And so we're going to hear a little bit about that, I think, today. So with that, I will move to Amanda. Matt, I don't know if you have to leave us today. I think he might have to actually go to another presentation. If you have questions for Matt, though, put them in the comments and he'll be sure to addressing those and getting answers for us. All right. Now, with that, I would like to bring to the stage Amanda Reddy. And Amanda is the Executive Director of the National Center for Healthy Housing, who will share information on the American Rescue Plan and the federal infrastructure funding for lead prevention. Since joining the organization in 2012, she's advanced numerous initiatives, including those related to healthcare financing of healthy home services, training and technical assistance to support the launch and growth of sustainable healthy homes programs, and the development of indicators for the HUD Healthy Communities Index. So with that, I will turn it over to Amanda. Thank you for joining us.
Thank you, everyone. It is a happy National Lead Poisoning Prevention Week. I think I have some slides, so hopefully those can be pulled up. Perfect. Thank you. And I think we can go right away to the next slide. And so we heard both Matt and Larry make a passing reference to CDC lowering the blood lead reference value. And I know many of you have been here all day sort of being inspired and captivated by all these presentations. So just in case you thought they were talking about back in 2012, I wanted to pause and take a minute to make sure that everybody had a chance to hear the news that just about 3 hours ago now, around 1 p.m. today, CDC announced that they lowered the blood lead reference value from 5 micrograms per deciliter to 3.5 micrograms per deciliter. So that announcement is just out. It's a terrific way to celebrate National Lead Poisoning Prevention Week to have this new blood lead reference value that will allow us to intervene earlier and connect children and families to needed resources, as well as having, potential policy implications. I think you can click a couple more times and there should be a couple of links on the slide here that would pop up to direct you to the announcement, as well as there's an MMWR report highlighting this work. So just in case you had missed that announcement and you thought that they were talking about the previous lowering of the blood lead reference value, wanted to make sure everybody had a moment to hear that news and join us in celebrating. But that's not why I was asked to come here today. If you go to the next slide, please. So I was asked to come talk about funding strategies, and specifically to talk about some of the opportunities around the American Rescue Plan Act of 2021. And then, as Matt indicated, I'll give you some updates on the infrastructure and Build Back Better agenda as well. So the American Rescue Plan Act of 2021, it may seem like old news with all of the attention and discussion that has been happening around infrastructure and the Build Back Better agenda since then. But back in March of 2021, March of this year, we passed a $1.9 trillion package of federal spending to provide relief for the COVID-19 pandemic. And that included $350 billion in fundings to states and localities. And you can see there on the slide the way that this is broken down, how much of that money is going to states, counties, cities, tribal governments, and non-entitlement units of local government, which are cities, towns, and villages, usually of less than 50,000 people. Can you have the next slide, please? So it was passed in March of 2011, and then in May, the Department of Treasury issued their interim final rule that gave us a lot more insight into the intended use of these funds. And so what we learned as part of that is that the funds, the way that this is set up, is that the funds are being distributed in sort of two different chunks, with about half of the funding distributed beginning in May, and another half of the funding expected 12 months later. So that'll be May of 2022. All of the funding has to be obligated by the end of 2024, so just about 3 years from now, and we have to spend all of it by 2026. So we'll have about a 5-year timeline to be spending the money. I will flag that on each of these slides, and hopefully we're able to make a copy available to all of you afterwards. We've highlighted some resources on the slide where you can get more links and actually go see the source of all of this information. Next slide, please. And so, you heard Matt saying there's a lot of opportunity. There's a lot of money hitting the streets right now. And I think there, obvious questions that emerge are what can we use it for, right? What is that money able to be used for? So under the American Rescue Plan Act, there are a set different categories of eligible activities. You can see them here on the slide. And many of them are really aimed at some of the direct impacts of the COVID-19 pandemic. But there are some broader categories here too, as well, things like supporting public health expenditures. The interim rule also makes it clear that funding can and should, in fact, be prioritized to serve the hardest hit communities and families. And there's a definition there of the qualified census tracts and how the Treasury Department is looking at that. And for those census tracts, if you go to the next slide here, some of the items that the Treasury Department has noted as eligible activities are things like addressing health disparities and social determinants of health, investing in housing and neighborhoods, promoting healthy childhood environments. Already that would give us a lot of cause to celebrate for lead poisoning prevention, but they went a step farther than that and actually called out lead hazard remediation and replacing lead service lines as specifically mentioned those activities as eligible activities. Next slide, please. So, of course, that's really exciting, but people may have some questions about what that might look like. What does that look like at the local level? And so back over the summer, as this news was being digested by communities, we reached out to communities, including many of you that have been attending today, to find out, either what your communities were considering or what you thought were good opportunities to you make the case for spending this money and investing in lead poisoning prevention and healthy homes in your communities. You can see the resource flagged on the side there. That is a blog written by our policy analyst, Sarah Goodwin, in partnership with a colleague from the Childhood Lead Action Project in Providence, Rhode Island, really outlining the opportunity and examples. And what we heard about the ideas that communities were exploring back in the spring and the early part of the summer fell into the categories that you see on the screen here. So we heard a lot of excitement about investing in lead hazard abatement and home repair programs. So that included increasing capacity of existing programs, but also establishing new programs, doing things like finding ways and mechanisms to serve families beyond program caps, right? Funding caps that sort of limit the extent of repairs that can be offered to a particular unit or home. Things like establishing free inspection programs or establishing repair programs that provide grants or no or low interest loans to help property owners make needed repairs, or expanding program criteria to allow childcare facilities to also be eligible. You can imagine if the childcare facility has an unresolved lead hazard, that's an opportunity to poison a room full of children. And if we can correct that lead hazard, that's an opportunity to prevent that from happening. We also saw a lot of interest. We heard Larry Brooks speak really passionately about the potential impact of partnering meaningfully with your local codes department. And that's something that we're really passionate about here at the center. And so we were delighted to see that communities across the country were also seeing this as an opportunity to look to their codes departments and partner with them to be able to address lead poisoning prevention and healthy housing. So some communities are thinking about establishing proactive rental inspections, right? If funding and financing was one of the big barriers of getting support of how we are going to actually implement an ordinance, this is a great opportunity to overcome that barrier and actually put it into action. Others are strengthening local codes or adding lead requirements to existing inspections. We've seen code departments asking for staff training or equipment needs and supporting that. We've seen communities looking at building RRP into their local permitting process or establishing demolition ordinances, or investing in workforce development. We know that many communities around the country really struggle with having an adequate supply of qualified contractors to do the work. So this is an opportunity to infuse some cash into subsidized or free training to help funding, remove that as a barrier to that training. We also saw that there was an increased interest in tenants' rights and protections. So things like establishing or expanding, if it already existed, pro bono legal services for tenants, or providing emergency funds for tenants who needed to move out of unsafe housing so that they didn't have to stay there while the system sort of worked things out, or investing in tenant outreach. And then finally, we have seen a lot of interest in supporting the removal of lead service lines, either free lead service line replacement for all residents that may have already had a partial replacement, or that still have lead service lines, sometimes in conjunction with supporting a ban on partial replacements at the local level, or, even just free water testing, free filters, free filter replacements for residents who may have lead in their drinking water. So again, this is not a comprehensive list, but hopefully gives you an idea of some of the range of activities, particularly those that are really specific to lead, that we have heard communities either considering or in some cases being put into action. Next slide, please. And we really do mean being put into action. So you can see in the blog that was highlighted on the last screen and on the screen now, some examples of states and communities around the country and how they are working to allocate this funding. So for instance, you see highlighted here the state of New Jersey allocating $10 million for lead paint remediation. Or in Buffalo, New York, we have $10 million for lead service line replacement and $1 million allocated for healthy homes inspection. I won't read all of these. You can look through all of them, but you can see that there are a number of different ways that communities are addressing, and not just lead, but also other healthy homes issues at the same time. So this isn't just theoretical. We're seeing communities actively move through this process. Next slide, please. In terms of sort of local opportunities, and many of you here may be even more expert than we are at this. So Pittsburgh's allocation was about $335 million. And our understanding is that about $17.5 million has been allocated for lead service line replacement and $2 million for lead paint remediation. The resources on the side of the screen there, there's a really great resource specific to Allegheny County that sort of maps out what the allocations are in Allegheny County and how you can get more information. But I know there are many of us here today who are not based in Allegheny County. So that second resource there is a link that can help you, research what the allocations might be in your state, your county, your municipality as well, to give you an idea of what the total funding is that's available. And I should also mention that as we have talked to states and communities about this process, everybody is moving at different speeds. Often what we're hearing is that states and communities are making sort of broad buckets of allocations and then refining it over time. Some communities, I think Utica, New York is a good example, are even just allocating funding in chunks. Like, what are we going to do with the first 12 million? And then what are we going to do with the next chunk of money? So if you are not engaged already in your community, don't assume that it's too late. I'd say check in on the process. And again, we have that second installment of the next 50% that's going to be coming in May of 2022. It's not too late to get at the table and make the case for why investing in lead poisoning prevention is great for the community. Go ahead to the next slide, please. And we've heard a number of people here today offer examples that you don't have to start from scratch, right? Many of the things that are under consideration here, we have great models from around the country that you can point to. That you don't have to invent the wheel. We can build and stand on the shoulders of those who have done this work, who have great lessons learned about what works and what doesn't. So I would encourage you to reach out to all of the folks that you've heard today. On the next few set of slides, I'm not going to walk through all of these resources, but hopefully we'll make the slides available to you. We also have resources at NCHH that help to highlight some of these case studies, point you in the right direction. Sometimes they're step-by-step guides on considerations for implementing specific things like proactive rental inspection or RRP permitting, demolition ordinances, and so on. So you can go to the next slide. We have them on local policy development. We have them on several lead-specific policies. We highlight resources from other organizations. Also, you see on this slide, the work at betterleadpolicy.org. Really, really terrific resources there. Next slide, please. And you see here even more. So again, those are just links will be resources for you after today's presentation. The message here is reach out to your peers, reach out to organizations like the National Center for Healthy Housing, and we can get you connected to case studies, technical assistance briefs, help put you in contact with peer communities, help you do the thinking about what the right opportunities are for your community and how you might, what strategy you might use to actually make the case. Next slide, please. So I want to take a few minutes here then also to mention some of the other opportunities that have been moving at the national level. Matt alluded to the fact that there are two major investments in front of Congress right now. The first being the Bipartisan Infrastructure Bill, which does include right now $15 billion for removing lead service lines. It started at $45 billion, had been reduced to $30 billion. It's currently standing at $15 billion. And I think we understand from our partners who are really leading a lot of the advocacy around this, that seems more certain now that investment is going to be made at that level. Really, really critical infusion of cash to be able to help support the removal of lead in drinking water. At the same time, you may have heard different terms. You may have heard it referred to as the Reconciliation Bill or the Build Back Better Bill, the Build Back Better agenda. And in that bill, we had previously, for the last month or so, been working from a House version of the bill that included $10 billion to support lead paint remediation in healthy homes. We had heard that they were trying to bring down the overall price tag of that bill and that had been in jeopardy. We have called upon many of our partners, many of you on the line here today, to help educate Congress about why it's so important to make sure that we have that investment in eliminating childhood lead poisoning and really finishing the fight against childhood lead poisoning. And it matters. So we heard today a statement from the White House was released today that specifically mentions lead paint remediation as being part of this sort of what they're positioning as the final framework for the Build Back Better bill. And just as I was signing on to give this presentation, I'm going to put this in the comments here. We heard that we have the updated bill text here that lead is currently at $5 billion, so not at the $10 billion, at about $5 billion. And you can see the breakdown in the chat there about how that is breaking down over different categories. So this is critically important. It's not the total amount of money that we need to solve the problem across the country, but it is an enormous opportunity for us to take a significant leap forward in finishing the fight against childhood lead poisoning and all of the racial injustices that it has perpetuated and continues to perpetuate. On the side of this slide, you see some links to sample language if you're interested in letting members of Congress know about why this matters. And as we have this final push, you can find some sample language there. If you're interested in reading the White House statement, that link is on the slide as well. Go ahead to the next slide. And just a word on some other federal opportunities. So Matt already mentioned that the significant and historic increases that we've seen over the past several years in the investment from Congress in both HUD and CDC-led and Healthy Homes programs over the past couple of years, which is really important. This one-time investment from the reconciliation bill, the Build Back Better bill, is critically important and will allow us to do things that we would never be able to achieve through the normal appropriations process. But these key programs remain really critically important. And so this continued, and not just continued investment, but increased investment is going to continue to open up new opportunities for us. I want to highlight also, again, one thing that this increased funding has allowed is to allow HUD to reintroduce the Healthy Homes production grants. Larry, I think I saw in the chat earlier, you were asking if HUD had any grants that could help you do things like systems change at the local level, start, work on proactive rental inspection or code enforcement or contractor training. And the really nice thing about the Healthy Homes production grants is they actually allow a certain portion of funding to work on issues like that at the municipal level. So it really is one of the more flexible sources of funding that this office typically is able to put out, and this increased funding level has allowed them to do that. So if that opportunity comes up again in a future year, I really, really urge communities to, get ready, start thinking about it now, get yourself ready to be able to apply for that. It's really, really important funding. The final thing I'll mention is that we know that EPA's revised lead and copper rule, EPA is currently working on holding on that and taking public comment to before they give a final ruling. But we anticipate that it will have new guidelines and requirements for water authorities. I don't have the time here today to talk to you all about all of those opportunities. I'm happy to talk offline about what that might mean for what opportunities might exist and how we might actually use the lead and copper rule to actually promote a more holistic approach to lead exposure, not just removal of lead service lines, but how we might use some of the provisions there to also get lead out of our homes, lead paint hazards out of our homes. And I want to highlight that our colleagues at the Environmental Defense Fund often write blogs about this. They've written many blogs on this lead and copper rule revision. I anticipate that they will continue to do so as we know more. That's a really great resource for digesting the rule and understanding implications and opportunities. So I think that's my last slide. You can go ahead and click just to make sure. Yeah, and so we are available. NCHH is here to be a partner to you, whether you just need, you want somebody to cheer you on, you need somebody to help come make the case at the local community, you want a thought partner, you need to vent about some of the things, the fighting the good fight. We are here, and we can also help bring stories from around the country about what's working in other communities.
Amanda, thank you so much. It's an unprecedented time for funding, and it's an exciting time for communities to know that resources are available for them in this space. So thank you for sharing all of that wonderful information. To close out our panel, I would like to introduce Karen Spidell, who's the Healthy Homes Section Manager at the Michigan Department of Health and Human Services. Karen will talk about utilizing CHIP funding for lead prevention. Just to give you a little bit of background about Karen, she oversees the operations of the Michigan Lead Safe Home Unit, Community Development Unit, and the Childhood Lead Poisoning Prevention Unit. Prior to her appointment, Karen had served as the manager of the Michigan Lead Safe Home Program. Ms. Spidell is experienced in project management, housing rehabilitation, and lead hazard control services. Her responsibilities include leadership to 40-plus staff members, development and operation of high-profile lead poisoning prevention initiatives, and performing fiscal oversight on an annual budget of nearly $30 million. Karen, it is so wonderful to have you here. Thank you so much for joining us.
Well, thank you so much. And I think I could have gone with Matt and said, we can just skip. No one likes to hear, most people don't like to hear folks talk about themselves. So, but thank you so much for inviting me. Thanks to Taylor, who had reached out about this. I'm so honored to be part of this and sharing, our great experiences here in Michigan. So I think we can go ahead. I know it's the end of the day, so I'll try to keep it brief. If we can start the slides, please. So really now taking what's been shared between Matt and Amanda and kind of taking it down to the actual state perspective and what we've been doing. And I'm sure most of you are familiar with Michigan and some of the the battles and things that we've been going through as a state for the last couple of years, and really kind of where we're going from here. And so going to share with you today just sort of our overall approach and how we're doing it and where we want to get to. So next slide, please. So I thought I would start with a little friend here. One of the thousands of tiny reasons why we do what we do, but certainly large in importance. And that is our friend Jairus. And Jairus's mom had shared some testimony. I won't read it for you. You can see it on the slide. But this particular family participated in our Let's Safe Home program. And as you can see, just really, really happy and feeling comforted that they have a Let's Safe Home to reside in. Next slide, please. So quickly talk about what we do at the Department of Health and Human Services here in Michigan. The section that I manage is our lead services section, and we have been going through a massive reorganization within our department focused around environmental health. And as part of this, we've done some reorganization of our lead specific areas. Most recently, the Childhood Lead Poisoning Prevention Unit, which was previously a separate program, has now merged with our environmental services side. So we have, the CLIP program, which I'm sure most are familiar with, as well as what we call our Community Development Unit, and I'll get into that more in just a moment. And our Let's Safe Home, program, due to the sheer volume and size of that program and complexity, we're splitting into 2 units, and it'll be sort of geographically served at that point. Next slide, please. Great. And then one additional change we've had is we have identified, through the reorganization, we thought there was benefit in separating out the regulatory side of the work that we were doing. And so we have a new section, which is the lead certification and compliance assurance section. Pretty self-explanatory, but really being the EPA authorized entity for the state of Michigan for compliance and enforcement, certification and training, as well as our newest unit, which is our quality assurance unit. And that's some really neat concepts coming out of that unit that I'll share a little bit later on. Next slide, please. So just to give you a little bit of background, this is our mission statement. And so really the key thing to keep in mind here is that our programming is focused on child health and home-based intervention programs. Okay, next. So where are we now? So with our services that we're providing through our section and our department, as mentioned, we're operating on approximately $30 million a year, and that's specific for lead services and the staffing and things needed to support that. And that's, of course, big thank you to Matt and his group at the HUD Office of Lead Hazard Control and Healthy Homes. Historically, always been our biggest partner and funder, quite honestly, and since the mid-90s. Beginning in 2014, our legislature, through some advocacy, through some great state partners and stakeholders, was able to advocate for a regular stream of general fund dollars. And then more recently, and this is sort of where a lot of the conversation today is focused on, the Medicaid Child Health Insurance Program, CHIP, or sometimes in other states call it S-CHIP. And this is providing about $24 million annually to be able to support environmental investigations or lead inspections and the abatement that goes along with that. And I use the term abatement here in a couple different ways throughout. So depending on the funding source, there's some differences there. So, lead hazard control or abatement, it will kind of be used interchangeably throughout. And so our section in particular statewide is addressing about 500 to 600 homes per year. And that is going to increase, I think, pretty rapidly here over the next year or so. Great, next slide, please. So our lead services section, so very basic information here. We find the lead through a full comprehensive environmental investigation, which includes a sequential drinking water sampling protocol that we're following in most of our projects. And so looking at dust, paint, soil, the drinking water, and then any personal items such as spices, toys, and that type of thing. And then at that point, depending on where the particular home funnels to, then we would do either abatement, interim controls, or a combination of the two. And then we have some family support services that I'll talk about as well that are kind of unique, and we found really a lot of benefit to connecting with families. Okay, next slide. Great. Okay, so what we decided, so back in January of 2017, the Medicaid CHIP, the $24 million allocation that I mentioned started. And so we jumped off the ground running with that. So prior to that, the fall of 2016 was when there was a lot of brainstorming happening about how this was going to be done, and how were we going to go from functioning on about $1 million a year for lead services to 25 million, even more at that point. And so what we determined was that we needed to come up with a two-tiered service delivery model. The first one was really an expansion of our existing Lead Safe Home program, which we call our direct service. And basically what that means is we have teams of staff that perform a variety of the functions needed through a typical project. And those are all performed, as I mentioned, as staff directly out of our office into the necessary and at-risk communities. The benefits of that, of course, you have higher quality assurance. You have staff you're better able to manage and monitor and just make sure that everyone is successful in this process. And we do find that we get a bit of a higher output in having staff who have certain functions and then looking to, lead abatement contractors and those environmental investigation vendors, contractors to be able to help support this work. The second tier of this model is our community development unit. And so when we heard news of this CHIP allocation for Michigan, after our initial panic subsided, what we realized was we can't do this by ourselves. And we never have really thought that. Back to the mid-90s, it's always been partnership after partnership. And in listening to some of the earlier sessions today, you can see that that's the common trend here. And so what we wanted to do was take those lessons learned and actually follow in HUD's path what they've been so successful over so many years in doing, in providing grants to, in our case, it was to communities to be able to implement lead hazard control programs using those Medicaid CHIP dollars. So currently we have eight communities across the state, and I say communities because some of them are serving multiple counties. And so we fund them, and through a couple different models, they then deliver the services to their community. So, of course, the obvious benefits are that they know their residents and their families best. And so being able to gain the trust of the community and to get into homes and really be able to tell that success story locally has been really beneficial. The other one is that we've had some innovative models for delivery of the environmental investigation and abatement services, internal crews versus external. So, looking at some of those communities are, contracting out the lead abatement activities on the homes. Some of them, and primarily our community action agencies, are actually, they have built internal construction crews that are actually part of their staff, and then they have a lot more control over in terms of how things are run and how quickly they're done. Next slide, please. The community development unit, as I mentioned, so this is where we're providing those dollars to the 8 communities. We started off with a competitive request for proposal that was put out to identify those communities who were interested and who could develop the capacity to be successful. And then once we had those entities on board, we wanted to reduce barriers to their success. And so what we decided to do was, once they were on board and meeting their metrics and their benchmarks and just really doing a great job, is to make it really easy for them to continue that funding into future years. And so annually, as long as our grantees are performing and things are looking really good, then we just automatically renew those contracts and those programs. So each grantee receives about, on average, about $1 million a year. And anywhere from 30 to 50 units are produced annually through that community model. Okay, next slide. And then our direct service model, Let's Safe Home. This is probably very similar to many of you that are on the call in terms of how you deliver services. So we're using internal teams. We've got what we call regional field consultants, who are sort of those project managers out there. Many of them complete the environmental investigations if they're not completed through a contracted individual. They oversee the abatement work to make sure things are going well. They do the clearance at the end and kind of problem solve in between. Our intake coordinators, so we've got staff, to do the processing for a variety of programs. And then those intake coordinators make sure they get connected to the right area and the right regional field consultant. And then I mentioned this earlier, this family support is really through our family services coordinators. And so we have 2 individuals that serve different parts of the state, and they are fantastic at what they do. They are social work background, but really they go out with our field staff, they meet with the family, they educate them, they connect them with relocation services or other wraparound services as needed, and just really help with that overall trust. It's a friendly face. It's consistently seen throughout the process by the family, and it ends up being this relationship that's developed throughout. I mentioned due to size, we're splitting into 2. And then our Let's Safe Home program is our statewide safety net. So being, public health for the state of Michigan, we have specific targeted areas where we're allowed to go with our funding as primary prevention. And then our Let's Safe Home program really provides that secondary response. So if we have a child who tests with an elevated blood level, then the Let's Safe Home program can typically assist with those services, even if they're not within a targeted area. And then the only other thing to mention here is we have a really unique model that we set up a few years ago in Flint, and this is working with an entity by the name of Genesee House System. And what they're doing for us specific to the Let's Safe Home program is they are following a detailed and documented engagement protocol with our CHIP money. And so we have lists, within Flint of all the residents that meet the qualifications for the CHIP funding. They take that list, they follow our engagement protocol, they go out, they do a series of door knocks and visits with the family, phone calls, follow up to really get them engaged in the program. And the goal there is just to get the highest number of families into the program in the city of Flint as possible. And that's been really successful. It also gives them the opportunity to connect to other wraparound services. Okay, next slide, please. A couple other programs. So we have one pilot, and in one of the earlier presentations, I was able to kind of relate to what one of them said about, pilots don't always work, and they kind of lead us a different direction sometimes. And so our Let's Safe Home Daycare program is one. It's been a bit of a struggle. Been a bit of a struggle to get it off the ground. But this is really focused on providing those same services, but this time in certain counties of the state to pre-78 licensed residential in-home daycares. We know that children are spending just as much time, or they were, in-home daycares and daycare centers as they were in their primary residence. And so really using these dollars to target those in-home childcare facilities, homes, for these services. So it's been a bit of a struggle. Again, it's when you start a program like this, it's building the trust. How do we build the trust of the childcare community in these counties? And so really, again, going back to, if we didn't have these partnerships that we've developed with different groups, our childcare licensing folks and our local entities that are assisting childcares, that we would not be successful at all. We also have a lead and water program. This is really ramping up, and it's something we've been offering for a couple of years. But as Amanda mentioned, in Michigan, a couple of years ago, our lead and copper rule was revised. And with that being the public health entity, our division wanted to make sure that we were providing adequate and responsive activities in these communities where there's been an action level exceedance. And what that means, like we call it an EL, so action level exceedance. What that means is that the municipal water supply, without going into too much of the science of it, has indicated that the community water supply, through a 90th percentile view, has lead in water. And so with that, what we've been able to do from the lead services side is then direct our lead inspection and risk assessment services to residents in those communities where we know there are children living in the homes. And we know that lead in drinking water is a contributing factor to a child's lead level, but it's not the only one. And so we want to make sure that we're fully educating about all the lead hazards, all the sources, getting in there, doing the sequential water sampling and all that. And so, it is at this time just a lead inspection risk assessment with the sequential water sampling, but we're viewing that as at least it's giving the residents enough knowledge to then make an informed decision about next steps. So we'll have more data, I think, on that program in the coming months. Next slide, please. Okay, so one of the things that I'm sure has been talked about at some point today is just the huge shortage in lead workforce, and specifically lead abatement contractors. I know that this has nationally been a problem. It's a problem that's continued here in Michigan, and we've tried all types of sort of golden tickets and just have not hit on the best one yet. But through that, some of the recent initiatives that we put through, we extended our stipend or scholarship training program so that individuals are able to obtain that lead training at free or low cost. Training multiple individuals within lead abatement firms, so they're having full crews and things. We also kicked off this year our workforce incentive program, which is providing a monetary bonus to lead abatement contractors that are successful through one of our funded programs. And so just really rewarding them and wanting to keep them on board as part of the team. And so then they can use those incentives as, if they want to provide their employees with a bonus or a holiday pay, or, they need a new equipment trailer or, new equipment or supplies, that type of thing. That's what those funds can be used for. We also pushed out a workforce media campaign that was in late spring. And so if there's any Michigan folks on the call, it's likely you've probably heard some of this, especially on social media. So radio and television ads, really trying to recruit workforce. And then collaboration with existing programs. Okay, next slide, please. So just a couple quick before and afters. We always like to share some recent photos and pretty dramatic ones. Next slide. I think there's one more. Yep. Great. And then this kind of breaks down, and I'll breeze through these last few just for sake of time. These kind of break down by our different funding sources. So I mentioned we have state general funds, we have HUD dollars, we have the Medicaid CHIP and our daycare program, and this kind of breaks down what we're able to do with those dollars. And I see Michelle up. Am I over on time? 2 minutes. Okay. Great. Thank you. Next slide, please. It's just a map of our services that we provide across the state. Next slide. Where are we going? So looking at getting our blood lead testing up after, because of COVID, our workforce development, I've talked about that. We're looking to implement some new initiatives. One is being able to provide a lead inspection for every EBL household across the state of Michigan, and that's getting much closer to fruition. And then big thank you and shout out to the Green and Healthy Homes Initiative and Ruth Ann and others on her team who helped in our state advocate for the establishment of a lead poisoning prevention loan loss reserve program fund. And happy to share more details of that if folks want to reach out by email. We have an online module for home visitors that we're putting together to put out there for some CEUs, and lots of quality assurance tools and programs. Okay, next slide. I know I'm out of time here. Hopefully these slides will be shared out. These, if you get the slides, these are the ones I would probably focus on. So really looking at lessons learned, around what we're doing when we have this variety of funding sources here. And if we have time or if there are questions, I'm happy to answer it, but I won't read through word for word just due to lack of time. Next slide. Some more things that we've instituted I'm happy to share more about. And then this chart, again, you can review at your own, your own time. But this breaks down the differences between all of the funding sources and really helping to identify where the biggest differences lie, which is in, if we go through one more slide, and then the next one, this slide really highlights where those largest differences are found. So the mechanism by which securing the funding, whether it's a HUD grant or the CHIP allocation, the eligibility requirements for the different funding, the documentation required, and are there barriers to application for certain programs, cost maximums, and where we're able to go with our funding and how much we're able to do. Okay, next slide. I think this is, yes, the end. So big thanks to anyone who may be on the call from many of our partners there. And thanks again to the folks here for inviting us to participate.
Karen, thank you so much. So much is happening in Michigan that we could spend a half day, session. Honest to goodness, just talking about all the different things that we can learn from all of you. And it's exciting that your slides will definitely be shown afterward, but it's exciting to see the significant progress that's being made in Michigan, and appreciate you sharing those stories with us. With that, I want to again thank Matt and Amanda and Karen for talking about these funding strategies that are so critical to lead poisoning prevention